Before I start to tell about the isokinetic test, to see the video first.
Isokinetic muscle strength testing. The patient is seated upright in the dynamometer chair, stabilized with chest, hip and thigh straps, and instructed to grip the chair handles throughout the test. The axis of knee rotation is aligned linear to the lateral femoral condyle, and gravitational correction is performed at 30 degrees of knee flexion. During the test, the patient is given vigorous verbal encouragement to exert maximal force throughout.
Based on this journal is tell about the isokinetic strength test. Isokinetic strength test is to measure a muscle strength at a consistent speed using by specialist equipment like biolase and sideways dynamometers. The machine is provide a variable resistance to ensure that no matter how much force is exerted, the movement is remained at a fixed velocity. This is to allow for precise assessments of muscle strength, power, and endurance across indifferent speed. This is a general citation isokinetic strength test and
So, this is the equipment that using for this test. So, this equipment is to measure the isokinetic strength test. The other name that we can tell about this equipment is Tset tool and Income tool. Next, I will continue with the objective of isokinetic strength test. So, isokinetic strength test helps to assess and monitor muscle strength, power, and endurance, especially after injury or surgery. Next, the objective of isokinetic strength test is to assess muscle imbalance. It helps to assess muscle imbalance or weakness that can cause us to injury. Other than that, it helps to guide the rehabilitation program. With the isokinetic strength test, they can help to tailor a good rehabilitation program that can give the good procedure for any special needs. Next is to determine readiness for return to sport. This is especially for recovering athlete that wants to go back to their sports. Next is specific application. Specific application can be used to evaluate muscle performance at different speeds, mimicking various functional movements. And lastly, objective data. It helps to provide data that is crucial for making informed decisions about treatment and rehabilitation. Now I will talk about the procedure. First, subject will position in the testing state with the Velcro strap placed across the chest, pelvis and distal aspect of the right leg. And then the second one is to maximize stability. Subject were instructed to grip the side of the table during testing, and the right leg of each subject was strapped to the input adapter of the hip comb with the center of rotation of the pad in 8.5 cm proximal to the tabiotalar joint line. And as you can see, the third one is the axis of rotation of the dynamometer was visually aligned with the lateral epicondyle of the right knee. And then the fourth is the table position, seat position, level arm length as tight, pad position, and hip angle. Mean and standard deviation of 106.9 plus 4.60 were recorded on the first equation and reproduced on the second equation.
Next, for the procedure, 4 progressive submaximal warm-up repetitions were done before each test to help the subjects get used to the speed and resistance. A 2-minute rest was given before testing started. The subject were then asked to do 6 maximum effort knee extension and flexions with the right leg. After each extension, there was a short pause of about 5 seconds before doing the flexion. The time between each extension movement was 30 seconds.
Next, I will proceed to the step 10 of the procedure. Subject were verbally permitted to initiate the movement but were not encouraged during the contraction period. No patient feedback was given either among repetition or between occasions. The isokinetic testing was performed through a range of 90 degree where maximum active extension was considered to be 0 degree. The starting position for each test was with the knee in 90 degree flexion. Each subject was evaluated on 2 occasions within 8 days of each other.
Okay, I will proceed with the result. If you can see over here, this is the result that we find in the journal. And then this is the result that I put in table. Okay, I will explain over here. These 2 tables shows men and women. The NM means Newton meter and SD means standard deviation. If you can see over here, the age they measure in general is from 45 years old to 72 years old for men. Meanwhile, for women, from 45 years old to 74 plus years old for women. The table divides into extension and flexion, both for Newton meter and standard deviation. This table states that this trend declines with age. That means both men and women show a steady decrease in knee extension and flexion strength as age increases. It's obviously over here, if you can see, starting from 45 years old, the Newton meter for extension, both for men and women, it starts to decrease from 103 to 90. Same for women. 108 to 79. This shows big decrease in both men and women. Same with flexion. In men, from age 45 to 54, the flexion decrease starting to decrease from 35. And then when they age to 72 years old, it starts to decrease to 38 flexion. Same with women. At age 45, start with 58, and then Newton meter at age 74 years old, 46. This means men have strength higher than women, if you can see over here. It shows a big difference in extension and flexion, even it is decreased from time to time and years to years. Flexion strength is lower than extension strength. Flexion strength is lower than extension strength, if you can see, both for men and women. Because across all ages and sectors, knee flexion strength is consistently lower than extension strength. So that is all from this table. Thank you.
Hello, thank you. Thank you for the earlier of the presentation. So we are going to the calculation. The calculation of muscle fiber for fast twitch muscle fiber and slow twitch muscle fiber. So as you can see here, we have 3 different formulas. So the first one is to calculate the torque loss percentage, the formula of fast twitch muscle fiber and slow twitch muscle fiber. So in here we are going to do this step by step. So the first one is we need to do the torque loss percentage first, and then we can go step by step to the second one, to the fast twitch muscle fiber, and then the third one, slow twitch muscle fiber. So we need to follow this chronology of how to calculate the fast twitch muscle fiber and slow twitch muscle fiber for traction. So let me elaborate you in detail. We are going in more details about this formula. So as you can see here, we are saying this PT at 1 to 3. So PT here is peak torque. PT, peak torque, where the person, when they do a bicycle with machine like this, and then the peak torque of their arm are shown, and that is the amount of from the machine that you need to insert here. So this one is for 1 to 3 reps, the first 1 to 3 reps, and then you minus it with the peak torque of the last 3 reps, just like this, and then divided by the peak torque of the first 3 reps, and then you multiply it by 100, and then you can get the torque loss percentage. And for the next one, we are moving to the fast twitch muscle fiber. So when you get the top loss percentage, you can now easily calculate the fast twitch muscle fiber. So by the formula of top loss percentage minus by 5.2 and divided by 0.90. So here you need to do this first, the upper one first, and then you divided it by 0.90. And then after we get the answer of fast twitch muscle fiber, and then if we want to calculate the slow twitch muscle fiber contraction, we are going to use this formula, 100 minus by fast twitch muscle fiber percentage. So that is the three formula to calculate the muscle fiber contraction of fast twitch muscle fiber and slow twitch muscle fiber. So I will be giving it to my next friend to present how actually we use this calculation. And that is all. Thank you.
Thank you, Alexander. I will continue to Alexander part for the calculation. So we will learn and use the formula that Alexander has explained before for this question, so that you guys can understand how to use the calculation. This is the data from the question. For the first 3 reps is 200 Newton meter, and the last 3 reps is 110 Newton meter. The question asks for the slow twitch and fast twitch muscle fiber percent. So the first thing is to find the percentage of slow twitch and fast twitch muscle fiber percent. First step, we need to find the top percentage. So just use the formula that has been explained. So this the formula for top is the first 3 reps minus the last 3 reps and divided to the first 3 reps multiple 100. So like this. The answer will be 45. So if you guys got the top percentage, this answer will be used to find the slow twitch and fast twitch muscle fiber percentage. So first we will find the fast twitch. If you already have the top percentage, we will use this data to find the fast twitch muscle fiber percentage, which is just use the formula that has been given, which is 40 minus 5.2 divided cos 0.9, which is we will get 40.2%. So to find the ST, which is 100 minus FT, you will get 50. This one. That's all. Thank you.
Okay, next I will proceed to conclusion for isokinetic strength test. Isokinetic strength test is a reliable and effective method to assess muscle strength, power, and endurance using context speed resistance. It played a key role in monitoring injury recovery, detecting muscle imbalance, and guiding rehabilitation or return to sport decision. With consistent procedure, the test provides accurate and repeatable results. Findings show that knee strength decline with age. Males have higher strength than females, and knee extension is stronger than flexion. This result highlight the need for target strength training, especially for rehabilitation and aging populations. Okay, this is the reference we use on lab, which is isokinetic strength. That's all from our group. Thank you.